may not go to the clinics as frequently as people with insurance, since the uninsured need to pay the medical bill out of pocket. As the Baltimore residents receive less primary care, they may have poorer health than the national average. To improve overall health outcomes of society, it is necessary to enhance the access to primary care. In 2016, the uninsured people for all age groups account for 5.6% of the entire population in Maryland. Since these uninsured people need to pay out of pocket for their medical bills, they may choose not to go to a primary care provider and treat the disease on their own. According to Tracy Kodak, Chief Executive Officer of the Healthcare Access Maryland program, the Maryland health system is complex and constantly changing. Some people need to help figuring out how to find a primary care provider. Social determinants of health directly and indirectly influence the physiological and psychological wellness of people. To efficiently and effectively improve the overall health outcomes of society, these social determinants, for example, the environment of the neighborhood, economic stability of the area, and the educational level in the neighborhood, should be considered. It should be clearly recognized that Baltimore has high rates of homelessness, opioid addiction, and homicide. These social problems eventually lead to high rates of chronic diseases such as hypertension and diabetes. Primary care is the first point of contact of the healthcare system, so primary care should be considered as the building block of the healthcare system. To develop the healthcare system into a well-functioning and integrated system, the access to primary care needs to be addressed. However, according to a white paper published in November 2008, the number of people who have access to primary care is declining. Primary care capacity is an important factor. A Rand Corporation health study published in November 2008 focused on the unnecessary emergency department visits and hospitalizations in Baltimore. The researchers concluded that due to the severe lack of primary care in Baltimore, especially in the East Baltimore area, the healthcare system in Baltimore was suffering a heavy health burden from unnecessary ED visits. This study estimated that Baltimore might need 130,000 to 159,000 more primary care visits to relieve the burden from unnecessary ED visits. Low level of education might also contribute to the low access to primary care. Patients have no knowledge regarding their health conditions, so whenever there is a health problem, they may either not go to any doctors or ignore the primary care provider and directly visit ED. Moreover, educational level may restrain certain people from obtaining information regarding primary care providers, which limits their access to primary care. The uninsured groups may also not have enough information about government-sponsored programs that can provide free or low-cost primary care.
Affected by the situation, the unnecessary emergency room visits can be a waste of healthcare resource and add the extra burden for the healthcare staff. If the people can maintain their health condition, the hospital can enhance their efficiency and use the precious resources to provide healthcare to people in need. Current insurance providers are also the critical stakeholder. Those providers include Maryland Health Insurance Program, Maryland Children's Health Program, Medicare, Medicaid, and private insurance. The whole system is constantly changing and complicated, so there should be someone to help people to figure out where and how they can find a primary care provider. Increasing the access of primary care will benefit the insurance provider a lot because people can prevent the incidence of serious diseases and decrease the time they go to emergency room healthcare spend. People without primary care physicians lack the chance to get the quick and proper healthcare for their daily health questions and regular body check. They cannot detect and prevent the potential health issues in advance. The primary care is a critical part of the whole healthcare system, but the number of people who have the access to primary care is declining. Although there are many primary programs exist, there are still gaps between the real needs. One major issue with access to those programs is operation hours. People aged from 18 to 65 usually go to work during the operation hours of the clinics, which is a big conflict and barrier. Lack of transportation is another barrier to the access. The operation hour is not flexible, so it's not convenient for people without car to get there on time. In addition, Maryland lacks the policy that can treat the mental issues properly. It is always intertwined with the criminal justice system.
In Baltimore, there are some people that doesn't aware the importance of primary care. They also have insufficient knowledge of the access and the services they can get. It increases the unnecessary ER visits and thus increases the burden of healthcare system. Now the needs are perceived needs. Because we see the gap between the needs and the services, we also see the lack of the awareness of the primary care. We hope that with the progress of our project, the needs will become the express needs and people will be more proactive to seek the primary care. We also wish that all the people in Baltimore will have access to the primary care. The target segmentation of our project are people in Baltimore that lack the access of primary care. Most of these people are not educated, have low salary, and have no insurance, and most of them live in West Baltimore. The total population in Baltimore is about 621,000. 10% of them have no insurance, so the size of our segmentation is about 62,000. To solve the problem, we have two solutions. In the short term, we can distribute the flyers, so people can get the flyers in the stores, bus stops, public communities, and other places they frequently go. They can get information they need easily with the flyers. Of this solution is limited, the barrier is low, and the outcome of the solution is visible. This solution can improve the awareness of people who lack the knowledge of primary care, push them to seek care, and increase their access to the primary care. At this step, we can recruit volunteers and collect donations. It's not difficult to distribute the flyers in those public places. Also, with a positive outcome, we can continue to the next step with more sufficient investment, and we plan to build an app to afford information of the nearest primary care agency, the services and the primary care, and the recommendations of the most suitable agency based on the entered keywords. We can also establish an NGO, and then we'll have much more investment and staff to build and improve the app. It needs a lot of time and cost. However, the impact of this solution is also significant. The app will improve the efficiency and avoid the waste of resources. It can also push to optimize the operation flow in healthcare system. Nowadays, almost all the people have their own smartphone. A free app that can afford primary care map is the best and cheapest way for people to get information. Also, with the improved awareness after the short-term solution, people will be more willing to seek access and information of primary care. Currently, there are several government programs that incentivize people's access and willingness to primary care. There is no similar service that can provide enough information of primary care in Baltimore. Our product will be the first app that can improve awareness and afford the information and recommendations to seek the primary care.
Mission statement is help people without insurance have access to free healthcare services. For example, cancer screening, which has low cost and great benefit. Mission is to create a non-profit community health organization that will help local Baltimore people to increase access to primary care, reduce their emergency room visits, and increase overall health outcome. We come out with 4 major value propositions. The first one and the most important one is our program is entirely free. The second one is we want to increase the screening and early treatment rate, especially for the STD patients and HIV patients. Thirdly, we want to have some behavioral change and form some support group for each other. Fourth, we want to partner up with some large health organization that will provide those free services. We have 4 key partnerships. The Bureau of Clinical Services, they provide free STD treatment and testing. Cancer screening services, you can access free and without insurance. University of Maryland Medical Group, MedStar, Wrestling, all can provide free cancer screening. There are also several hospitals that will provide National Diabetes Prevention Program, MedStar Franklin Square Medical Center, MedStar Good Samaritan Hospital, the Bracadic Center for Advanced of Community Care, University of Maryland Medical Center, Mercy Medical Center, St. Agnes Hospital. And for the behavioral health system, they will form some support groups to provide support for those who need help. CareMap is an entirely free program. We will have free testing and treatment, free cancer screening, free diabetes prevention, which will be a group activities on how to eat healthier, exercise more, and lose weight. We're also going to have 24/7 support line for crisis intervention, substance use treatment, mental health treatment, and overdose prevention resources. We're also going to help our customers to access to insurance, provide their proper links for the insurance they will need. CareMap will have free and easy access. It will be an automatic service. You find the information you need on our flyers or the website. We are going to divide our customer into disease type and insurance type. For disease type, we have hypertension, breast cancer, prostate cancer, etc. For the insurance type, we're going to divide them into Medicare, Medicaid, private insurance, or no insurance at all. For key resources, we're going to have government-run programs as our main source, and communities members who can help from church or school. That will be great help. We are going to have 2 main distribution channels. One is monthly free printout flyers customer can easily access in the short term. And we're going to have a website with all link information in the long term. Our market size is going to be citywide. People who do not have access to insurance coverage can enter the free programs. On the right, we can see a government-run website that shows specific information about healthcare providers. Our goal is to provide the free service that you need from the area. For our cost structure, in the short term, we'll be mainly need help from volunteers to print out the flyers that we'll send to the communities. In the long term, we'll establish a non-profit community health organization that will be elaborated later.
Government-run programs, churches, and active community members are the key resources. With the efforts of volunteers, there will be an app that allows people to search the distribution of primary care agency. Then the survey before and after the activities will help us to evaluate the outcome and impact.
A non-profit community health organization will be established to address all critical components of how one would bring the proposed solution to fruition. A board of directors will oversee the activities of the entity. CEO, CMO, and CFO will report to the board weekly regarding their progress. CEO will take charge of the daily operations of the organization. CMO will address potential barriers to market acceptance. CMO will also look for opportunities to collaborate with other government-sponsored programs and non-government or non-profit organizations. CFO will focus on fundraising and financial resources to support the function of the organization. Each chief officer will have his or her senior management team to enact and monitor their duties in details.
For the evaluation plan, we will propose a questionnaire for all the people. And we also follow the timeline. At the beginning of the project, we will do the survey and give the map to people who need access to primary care. After 3 months we give the map to the people, we will do the survey to the same community and count the number of people who have access to free primary care right now. At the same time, we will propose our website to the people and tell them they can find all the information they need from the website. After 3 months of the implementation of the website, we will do the survey again and ask them for some feedback to the website. Number of people who goes to primary care improves. We think this proposal is successful.
A website that offers the guideline and resources for people to seek free testing and treatment of their disease, form group to incentivize health, and get access to insurance through the partnership with many government programs. Patients out of primary service can be informed by the flyers and find the resources they need through the PC or smartphone, a way that is affordable for them. They are segmented by insurance type and disease type, which can provide a more specific and user-friendly way to help the patients to search what they want. From the market perspective, there are many government-run programs exist, but they cannot be reached by people who need them. We link those discrete programs together and create an integrated platform. It depends on the volunteers who work for the website and monthly printing and distributing, so it is easy to operate. The program starts from distributing flyers and questionnaires to gather information. When we get enough resources, we can build the websites to influence and benefit more people in the long term. This community-based program can encourage people to care more about their health and influence the others. There are many characters in The Wire that lack primary care, especially the care for mental illnesses. Ziggy, the worker on the dock and the son of the president of the union, always acts like a clown in other people's eyes. He lacks the care from his father, and all the people around him make fun of him. He can rarely have the chance to work on the dock. After he shot a person to death, he felt guilty and regret, but he would do that again even if he got another chance, because he was psychologically distorted at that time. In addition, the state of Maryland does not have a proper policy to deal with the mental illnesses. If those people can get instant and free access to the primary care, it will relieve the pressure of both the patients and the whole healthcare system.